Thank you for zooming into our webinar today for our Monash Partners Consumer and Community Involvement monthly webinar series. Today we are going to be talking about setting up consumer advisory committees for health services, and very privileged to have some guest presenters with us today. So we have Dr. Sinni from Peninsula Health, who is the Director of the Safer Care Unit, and from Epworth Healthcare we have Sheila Daly, Executive Director, Clinical Services and Chief Nursing Officer in an acting role, and also Lauren Laylaw. So they will be giving their presentations shortly, but to kick us off, I'm just going to give a bit of an introduction to our team at Monash Partners and what we are offering for you guys. So next slide. So some of you have joined our lunchtime seminars previously, but this is an opportunity for us to highlight some principles and practices and frameworks and research that is happening in the consumer and community involvement space. As always, we want these seminars to be of relevance to you. So if you have any ideas or feedback on what would be helpful for you, please let us know. It is also an opportunity for us to connect with each other. So connecting health providers, researchers, managers, and consumers. And this is an opportunity to learn from each other. So we really do want you to be able to ask questions and discuss topics of interest. Today's seminar, as you all know, is being audio and video recorded, and we'll also be recording and monitoring the chat. The reason we're video recording this is so that we can put it up on our webpage so that people who weren't able to access it today will be able to view it. But we will also be sending an email out after this with some key points from today's seminar. So next slide, Sarah. So before we start, I'd just like to do an acknowledgement of country. So I start by acknowledging the traditional custodians of the land on which I'm standing, and in the spirit of reconciliation, I pay my respects to their elders past, present and emerging. I extend my respects to any Aboriginal and Torres Strait Islander people joining us today. Wherever you are, I acknowledge and pay respects to our First People. So as we mentioned, we're going to hear from our guest speakers today. After that, we're going to do our 3 rapid fire questions, which we're asking all our presenters through this seminar series. And then it will be over to you guys to ask questions and to have some discussions. So Sarah, next slide. Oh yes, just to highlight, we have our consumer and community involvement platform for those of you who haven't accessed it. There's training and resources, 6 self-paced modules. You can contact us for any advice that you might need from that email address. And we have a few tip sheets around how to engage with consumers using technology, and of course this lunchtime seminar series. We really want you to be able to be engaged and feel supported through this time. So please say hello in our webinar chat. Great to meet you and know who's online. And also ask lots of questions. So as our speakers are speaking, please feel free to put in any of your thoughts or your questions. Sarah's going to be monitoring that, and we'll come back to some of your questions and also have an opportunity later. But we just wanted to say we've got a variety of different people online today, so please be respectful of the diverse experiences and opinions that we might have from different organisations, groups, roles and experiences. And if you are having any troubles using the Zoom webinar, we know online stuff doesn't always work or go to plan, please contact us and then we'll do our best to troubleshoot. And we will have a feedback survey at the end to help us plan for future seminars. Excellent. So I'm now going to hand over to Sheila, who is going to provide us with the Epworth perspective and learnings on partnering with consumers. So over to you, Sheila.
Thanks very much, Dashi, and it's a privilege to be here with you all. So thank you for the opportunity. Like all journeys, they're interesting, so we're happy to share and share warts and all, so to speak. So next slide, thanks, Sarah. I too would like to pay my respects to and acknowledge the people of the Kulin Nation and the traditional custodians of the land upon which we work and care for our patients, and honour their unique and continued spiritual connection that Aboriginal and Torres Strait Islander peoples have to land, water and culture. The presentation today is, the next slide, thanks Sarah, is going to just tell our story about a little bit about Epworth Healthcare, where we are in the consumer engagement space, our journey, and obviously the challenges and key learnings that are continuing. So next slide, thanks, Sarah. So for those of you who don't know Epworth, it's the largest not-for-profit private hospital group in Victoria, and it's renowned for its, its care from emergency right through to rehabilitation. And we also have maternity and pediatrics, so quite a diverse backgrounds of ages, and a very strong focus on patient experience and ensuring that every patient matters, and ensuring that our people understand that, and we are privileged to care for our patients across all of our spectrum. Partnering with consumers is connected to all aspects of care at Epworth, and we know that if we truly embrace the connection of consumers, anybody who's been in our care, potentially going to be in our care, or any of their loved ones, we really are best prepared to look after them and provide the care they want, rather than the care we think they need. And we're often good at that in healthcare, where we plan care around what we think we should do. Next slide, thanks, Sarah. The drivers of consumer partnerships, most of you would know that obviously it's a requirement under Standard 2 of the national standards that there's an expectation that we partner with consumers, and obviously the Australian Charter of Rights is an expectation. The basic rights of patients and consumers are entitled to access health. But I think, quite often these are the drivers, but for us, we realize it's actually the right thing to do, and you also get better outcomes when you truly partner. And I think traditionally people, I guess, have been passive recipients of care in health, but now we're really involving people through their care journey. You get far better outcomes and far better engagement throughout when you collaborate and partner together. So thank you. Next slide. So basically, those of you on screen will have seen this before, the different levels of consumer engagement. And we all know that we're very good at informing our patients and consumers, and we're good at telling them what to do. Sometimes we're good at consulting, but I think into the future, we're getting better at involving and collaborating. And I guess the lovely consumer-led model, which is what we all aspire to, is where we'd like to be. But to be honest, I think we're a long way from that, but it's definitely an aspiration and a realistic aspiration. So that's the goal. So next slide, thanks, Sarah. So who are our consumer advisors? So they're volunteers who've had experience at Epworth through either being a patient, a carer, a family member, or somebody in the community who has heard about us and wants to be involved, so to speak. And the consumer advisors provide advice in a formal capacity through a range of different areas. So traditionally, we've been very good at reviewing brochures and getting the consumer tick, but we don't actually, get in at the front end, which we're getting better at. Serving on governance committees, and the great thing about our journey is that we now have consumers sitting on all governance committees in all of our hospitals. And interestingly, it's about finding the right consumers to sit in those spaces so that they really can add value and feel really part of the team. Obviously, we have a lot of offline activities, workshops, and over the COVID experience, we've done a lot of Zoom connections, and certainly adding value in that space. Serve on working groups, and as I said, co-design and consumer-led is the way of the future, and that's where we aspire to be. So next slide, thanks, Sarah. So we know through Safer Care Victoria that to achieve better outcomes for health services, we must really work with our communities and really understand their needs and listen to them. And consumer advisory committees provide a formal way to do that. And we know that consumer advisor members vary in their level of voice and their experience, but we really want them to participate with us in the plan, design and delivery of our services and to continually improve those services. Our current consumer advisor members bring their own diverse experience and knowledge. They hopefully promote the views of the wider Epworth community, and that's definitely a journey for us. Advise Epworth on a variety of different matters and processes that link to our strategic priorities and service delivery. And that's an evolving process, to be honest, and help inform the community about what's happening at Epworth. I'll tell you a little bit of our journey, because I think that's probably the interesting part for this group. So next slide, thanks, Sarah. So the Consumer Advisory Committee was founded in 2014 by an ex-chair of the board back then, and we had 6 committee members, and certainly a number of them are still involved in some way, shape or form. But I think it was very much a gathering of people where we shared information about what was happening at Epworth and asked their views on our brochures and what we had already developed, rather than really in that co-design and engaging them early. Over the years, we have changed our approach, and going back then, it was very much somebody tapped somebody on the shoulder to say, would you like to join our Consumer Advisory Committee? And it was through word of mouth and no real formal processes in place. Over the years, we've formalized those processes and have some very clear communication to the groups to explain what it is a consumer advisor is, so that they know exactly what the expectations are, so they're able to participate much more meaningfully. When you're tapped on the shoulder, you obviously still participate, but I think we probably didn't embed them into the Epworth system, so to speak, as much as we would have liked to. Whereas now, as we've changed throughout the years, we've got much more robust systems and processes in place to attract and retain our consumers. Next slide, thanks, Sarah. So our journey, as I said, in 2014, that's where we started. In 2019, a number of our existing consumer advisors recognized that the consumer voice was changing and probably didn't feel they could add as much value as they could have. And with all of the changes in the community and all of the advice, we knew that we needed to have a much more robust process in place. So in 2020, after a significant period of time, we developed our Partner with Consumer strategy, which is available on our website. And it really explain to our teams and our executives what it is to truly partner and go beyond the compliance piece that we had traditionally done. The launch has really created a really good burning platform. We went from 9 consumer advisors to almost 40 now. And as I said, consumers are sitting on much more operational committees than they traditionally had. With that, the changes in the CAC then kind of gave us the opportunity to really have a broader, diverse group. So our advertising to become a consumer advisor, we shared more broadly and really tried to attract, a really diverse range. So we got the voice of a number of people. I think we have within the advisory, we have a smaller group than we would like, and we certainly want that to be a very dynamic group. But I think we have within that 40 that we've grown, we have a number of people who are well placed to sit on our CAC going forward. So I think it's nice to have them understand the business, so when they actually do join the CAC, that they can contribute more meaningfully as we progress. Thank you, Sarah. Now I'm actually going to hand over to Lauren to share our next steps. Thank you, Lauren.
Thank you. So as Sheila mentioned, Safer Care Victoria have got Building Your Healthy Community, which is a guide for health services around community advisory committees. And this is kind of based on the Health Services Act, and there are requirements for public health services regarding community advisory committees. And for us at Epworth, it's a bit of a challenge because we're not a public hospital, we're a private hospital, a not-for-profit organisation. So for us, these help provide recommendations for what we aspire to. And so really what we're hoping to do in the future in terms of developing our community consumer advisory committee. And part of that work is around attracting consumers. So as Sheila said, we've currently got 3 members on our CAC, but the recommendations are to have that 8 to 12 consumers to help really get that diversity and that voice of the community. So that's one of our challenges at the moment, is really how do we attract consumers to partner with us at Epworth, from our individual local activities to that greater involvement in governance in the CAC. We also want to have that representation of our diverse community and ensure that we're getting the consumer and community in voice in our discussions. Looking at the clarity and purpose of the roles for our CAC and really how it integrates within our health service. And for us, one of our challenges is around measuring the impact. So we know it, there's great impact when our consumers are involved. We feel it, we hear it, but how do we actually go about measuring that? And so that's one of our challenges going forward. Next slide, please, Sarah. And so looking at how we're continuing to evolve, our next steps at Epworth are around consumer involvement in research and clinical trials, how we continue to build our consumer register. So over the last year, we've seen it grow from about 9 to 40. So we've had a great growth, but how do we continue to grow that and really get that diversity within our consumer register? How do we also support our consumer advisors? So how do we build their capability and support them? What are the extra skills and knowledge that we can help support them so that they feel comfortable and capable in joining and sharing their voice? And also looking at advancing along the continuum of consumer engagement. So as Sheila said, often we're quite good at creating material that we think consumers want and then asking them their advice, but actually how do we change that culture and have staff coming to us first, to our consumers first, and saying, what would you like? Let's build it together so that it really does meet your needs. So they're kind of our next steps and what we're working towards at the moment. And that's our presentation. Thanks, everyone. Would you like us to do questions now, or?
Not just yet, Lauren. So we'll open it up to questions after Sue's. But thanks so much, Lauren and Sheila, for presenting. We're going to now transition over to Sue's presentation. And as we said, put the questions in the chat and we'll have a time for discussion afterwards. So over to you, Sue.
Thanks, Dash, and thanks, everyone. Thanks for the opportunity to present. I'd also like to acknowledge the traditional owners of the land. I'm lucky enough to be on Boonwurrung and Boonwurrung, and my screenshot is Bridgewater Bay. So I'm very happy to present what's going on at Peninsula Health. There's the photos that you see are of consumer representatives who work at Peninsula Health, and I'm presenting on behalf of me, Michelle Daniel, who's the Consumer Participation Program Manager, and Helen Wilson, who's the Volunteer Program Manager. Next slide, please. So I'm just going to talk a little bit about Peninsula Health to give you the context, what our history is in the consumer space, a bit more about the consumer and volunteer programs, the governance arrangements and our future directions. I'd just like to point out John, who's on a couple of our governance committees. John's been a very important member of the consumer representative cohort at Peninsula Health for a long time. He has been through the community advisory committee and now he's an ambassador. He's done his 9 years, and after you've done 3 terms, we offer the opportunity to stay on, and we're so glad that John has decided to stay with us. Next slide, please. So for those of you who don't know Peninsula Health, we're down south on the Mornington Peninsula. We're a major public health service. We've got 4 inpatient sites. I think that adds up to about 900 beds. And we've got 7 community health centres, and we've got about 20 other hubs around the place. We have a very diverse demographic. We have very, very wealthy people and very, very poor people and all the things that come in between. We have around 2,000 First People who live in and around our catchment. Of those Aboriginal and Torres Strait Islander people, we've actually just launched our Reconciliation Action Plan. And we're very lucky to have an Aboriginal elder work with us. She's a Peninsula Health employee, and we have learnt through Auntie Helen and her peers that a lot of First People who live in and around the Mornington Peninsula don't have a strong connection with their own personal history. So that's something that we're working with Auntie Helen to help support. So we're really excited about that piece of work. You will note that I go off on a tangent. Please keep me on track. We've got over 6,500 people who work at Peninsula Health. Interestingly, the additional 500 came from spotters and all things COVID, extra security staff, etc. We've got about 700 volunteers, of whom around 80 are consumer reps. And we're very excited because a new Frankston Hospital is due for completion around 2025. So there's a lot of work in that space and a lot of consumer involvement in design and service planning. Next slide. So Peninsula Health first established a community advisory committee in 2004, and that was based on the legislation that was referred to. The way that we arranged our CAC was to have representation of each of the community advisory groups, and you'll see that in a future slide. We've got 12 community advisory groups. We had a few more, and they requested that we disband those groups. They didn't want to be part of a group just for the sake of being a group, rather that we would ask them for advice when we needed advice on a particular matter. So the Aboriginal and Torres Strait Islander support group would be an example. They felt that they were meeting for the sake of having a meeting. They would much rather be involved in things like service planning and doing cultural surveys, etc. We've also got consumer reps who are involved in strategic and local decision making, obviously developing consumer information, and we have them involved in staff education, so in simulated learning environments, which is really well received by our staff, and the consumer reps really like being involved in that. Next slide, please. So this is what the governance looks like at the moment. It is, as Sheila and Lauren alluded to, it's a really exciting time, and congratulations, by the way, going from 9 to 40. That's a massive achievement. Well done. There is a lot of movement in this space at the moment with the new framework that was launched by Safer Care Victoria. We are very lucky to have some fresh eyes looking at the way Peninsula Health does things by new members of the executive, new members of board, and the CAC in revitalising itself. We had a really exciting workshop there was a lot of engagement for the CAC with board members and the executive. It was maybe a month ago to set the scene for what we will do in the future. So while this is the governance structure, it may well look quite different in the future. The CAC has always been represented by CAGs, and sometimes that's meant that the CAG refers someone who might not be comfortable operating at a CAC level. That's not to say that we haven't had great engagement from all of the members. It's really served us well. Next slide, please. So volunteers and consumers are two separate groups at Peninsula Health, but they are all recruited the same way in a very formalised approach as we would paid staff. So our volunteers have raised a lot of money for us, and for that we're very grateful. As I said, we've got about 700 people engaged in that space. COVID really halted our ability to progress in a lot of ways, and I'll talk a little bit more about that. Our youngest consumer rep is 31 and our oldest is 91. The average age is 64, but we're very excited about a Voices of Youth consumer group, which we're doing in partnership with a a local secondary school, and so that of course brings the average age down. We've got lots of really exciting work happening with them. Next slide, please. So during COVID, when I say we halted things, disappointingly, and obviously everyone's in the same boat across the world, we had to stop all of the consumer and volunteer participation face-to-face. That was where they're involved in individual departments. So we started a campaign pre-COVID to have a consumer representative engaged to work at every ward, so that they could be involved in ward meetings, look at clinical incidents data, or look at complaints data to help local areas make improvement plans. We were getting some really good, so that started in about 2018. We were getting quite a bit of interest, and we were starting to recruit, and anyway, COVID happened, and so that's halted. So we're very excited about getting that up and running. Our actors in simulation training, obviously that stopped, so we reverted to videos. We have had involvement in service planning, etc., by using online platforms. We were constantly recruiting, which we're very lucky to. I need to say also that because we live on a peninsula, or we work on the peninsula, we have a captured audience, and we have a lot of people in the community who really want to get involved with the health service. So I acknowledge that we're in a pretty privileged place in that space. Michelle is overwhelmed with applications for recruitment, which is wonderful, and so is Helen. So we just need to keep up the momentum of getting that recruitment going. The Voices of Youth framework is something we're really proud to have initiated, and they are very keen to get involved in our paediatric services and just to have the voice of young people. We know that it's very difficult, well, we know from our own experience that it's very difficult to get young people involved in anything as perhaps not interesting as a hospital, but we discussed it together, and there was support from the school's senior leaders that this would be a good idea. And then when we took it to the students, they were really excited about the opportunities to have, design an emergency department, for example. We were lucky to have most of the consumer participation program transition to virtual meetings, although they are really, really keen to get back to face-to-face meetings, and we're transitioning back to that on a risk-based approach. And the volunteer program pretty much stopped. We managed to get whatever we could transition to virtual meetings on that platform, but I'm sure you can appreciate that the volunteer who sits by the bed and assists the patient to help with falls prevention strategy, we couldn't do that, obviously. Next slide, please. So, as I've just mentioned, this is what our meetings have looked like over the last 12 months. And we're very happy to say that our Incident Command Centre has approved our risk-based return to face-to-face strategy, and we'll be starting that soon. Next slide, please. So we have a consumer participation policy, and like the what I referred to about the Community Advisory Committee, we're really excited about the opportunity to refresh based on what we discussed at the workshop, based on the stuff that's come through from Safe Care Victoria, and as Sheila said, based on what is the right thing to do. So underneath that framework, we will review all things consumer engagement, so what happens at point of care, and then the governance arrangement and how we involve consumers and that co-design about making decisions together. We have a formal evaluation in progress of our volunteer program. We've issued some surveys and we've got ethics approval. We'll be hoping to write that up in our spare time. And we are also using a lot more co-design methodology. We're using that in a comprehensive care project. we're using that in how we educate staff from learnings of clinical incidents. And we're also thinking very much in the space of how we get consumer participation in the clinical trials, clinical governance framework. I just want to shout out to Monash partners, because we have been very much supported by Monash partners, and we go into the CCI portal quite a bit to get, and I point people in that direction a lot. When people say, oh, what are we going to do about consumers? Well, actually, we don't need to develop things that we've already been part of that conversation about developing those tools. Just go to Monash Partners. So thanks very much for this opportunity. And next slide. Some more pics about all of our consumers. So top left is consumer reps. That's simulated learning that I referred to, the students from a local college, and another one of our consumer reps. Next slide. That's it from me.
Thank you so much, and thank you to all of you who've spoken and presented today. So before I open it, and we've had some great engagement on the chat stream, so we're going to open it up shortly, but because you guys have shared such incredible journeys, and I think what I really liked and took away from your presentations is these things didn't happen overnight. They've been a process of evolving and growing and rethinking through strategies. And I loved your honesty on things that were hard and things that were challenging around engaging with consumers and getting diversity and getting numbers and recruiting and all of those types of things. So thank you for your honesty, and thank you for sharing that journey. Sarah, is our 3 questions on the next slide? Yes. So these are our rapid fire 3 questions that we're going to ask each of our panel members to respond to. So we'll start with question 1, and we'll go Sheila, Sue, and then Lauren, because that's the order that you are on my screen. So Sheila, what has been one of your key learnings from your consumer and community involvement work?
When you actually engage the right consumers, it's a fabulous experience, and I think yeah, it's a joy to behold. So I think while it might be challenging to get it right, when it works, it's perfect.
Thanks, Sheila. Sue?
You can never have enough consumer involvement.
Love it. And Lauren?
Yeah, and I think one of the other things is just making it easy for staff and just simplifying the process. And it's actually really easy to involve our consumers at that point of care, talking to them, and from there having those discussions and making the consumer involvement a discussion that happens for everything. You know, a policy comes through, have we had a consumer review this? That kind of thing. So just making it into everyday work is really important.
Love it. Thank you. Okay, question 2. Kicking off with Sheila again, what has either been the best or worst advice you have heard about consumer and community involvement?
I think the worst advice I've probably heard is that you know, you're going to be told what to do, and they're going to come in and, you know, be really confronted by your business, and in actual fact they really add value. So I think that's it. We've got to dispel some of those myths.
Yeah. Sue?
I'm with you, Sheila, so I'm just going to go with the worst as well. They, being consumers, don't know anything about healthcare. Why would we involve them?
Yeah, good one. And Lauren?
And I think we're all getting the same advice, because mine's exactly the same. It's what everyone is.
It's a bit of Mythbusters in that second question, and I do think I've heard that advice a lot as well. So thanks for sharing that. And our final question, what would better look like for consumer and community involvement in health and medical research and healthcare improvement? Sheila?
I think truly partnering, my comment is better together. And I think when you truly partner and work together, it will certainly, everyone wins.
Yeah. See?
So I'm going to quote Sheila in her presentation at the start when she said, or when she referred to consumers being the first thought and not the afterthought. You know, you've got a project or an innovation or something, and the first question would be, what consumers can we get? Or we need to contact Michelle for some consumers. That's yeah, where I'd like to be.
Excellent. And Lauren?
Yeah, I think I'm with Sue on that one as well, in terms of just having that consumer engagement straight up front, and really also having our consumers lead us and guide us on what projects we should be doing that are important to them.
Love it. Love it. I find these rapid fires so great because you just shared some perfect little gems with us just then. So thank you so much. We're now going to open it up to questions from the audience and our participants. So Sarah, I think there are a few that have come through. Did you want to pick some out from our conversations?
Yeah, so we've got a few questions. Our first one we've got from Julie, and she had a question around how do we start broadening consumer representation of underrepresented groups?
So over to any of you on the panel if you want to tackle that question. I know it's a difficult one.
I'm happy to start. I think that's tricky because I think there's an appetite to have a very diverse group, but it's actually making it, I'm going to say attractive is the wrong word. I just don't think we need to focus in certain areas. I think we need to just be open, and then when you've got the right environment, it will attract people. But it's tricky because even just getting consumers to give, and I think coming out of COVID, I think everyone is challenged and everyone is tired and probably a little bit, I guess, they don't have the capacity to give back. So I think it is going to be tricky for us into the future.
Sarah, can you just repeat the question?
Yeah, let me go back to it. Hold on. So the question was around how do we start broadening consumer representation of underrepresented groups?
Thanks. Just wanted to make sure that I had it clear. So, look, I go back to, for Peninsula Health, we live on a peninsula and we've got, really diverse demographic, and people want to connect with their health service. So, lucky us. What we have found, and this is all part of our innovation and thinking about what's the future look like, within those groups. So if we look at the LGBTIQ CAG, for example, who started lobbying Peninsula Health, I think it was 2011, to go for the rainbow tick, which was finally achieved in 2017. That was all their work. And I'm absolutely confident that they won't mind me saying that they don't like being lumped together as the LGBTIQ CAG, because each member of each of those different labels, lesbian, gay, trans, they don't want to be lumped together. They want us to think about what their individual needs are. We have a diversity committee, which is a high-level organisational committee, and we have consumer involvement there. And we have representatives from the CALD community, from elder persons, from disability, and the conversation is the same. Why are you lumping us all together and calling us diverse when we're all individuals? So we're looking at how we can, I guess, value and appreciate everybody's individual needs, and work from that platform, rather than say, okay, we've got a diversity committee and we're just going to send that to whichever group. I don't know if that answers the question, but it's really important to get that breadth of ideas from across that population, across the whole population.
Great, thank you, Sue. Now there's a few questions here, so I'm just going to work through them in order. So I don't think there's, I haven't missed anything, but I'll try and go. Our next question is around terminology. So had someone asking about how we label things or call things. What's the difference between a policy, a framework, a volunteer, a consumer carer? How do you work with the language?
It's Sue. I'm happy to answer that question. And I saw the question come up and I thought, absolutely. So I think it's really important in our organisation for it to be clear. So it's clear for us. And as I was talking about policies and frameworks, I thought about, you know, where our documents are and how we engage with them. So that's how we understand what we mean at Peninsula Health when we talk about consumers and volunteers. They're very different. They all have to be recruited as volunteers, because, you know, none of them are paid, and there might be some questions about payment. There are sitting fees, there are a whole lot of other things, but I won't go down that path. So we have to be very clear, and we're very clear with consumer representatives to ask us questions if they don't understand what it is that we're talking about, as long as we're clear on the definitions. I think that's what's important.
Thank you, Sue. Another question here from John, and is asking a bit about the term co-design and what that means, and if you're following a very structured co-design approach, or how you're sort of using that co-design language.
So I think, Sheila, you mentioned a bit of co-design in your presentation. I'm not sure if you wanted to touch on
Absolutely.
how you're doing that. Yeah.
That's the future. We're not there yet, unfortunately. I still think we're in that, you know, tell rather than really co-design, and that's where we want to be. But certainly looking at different ways of co-design.
Yeah, so for example, I guess, Sheila, I might talk about the complaints management process that we're currently looking at. So at the moment, we're reviewing how complaints are managed at Epworth, and you know, traditionally we probably would have got all our staff that were involved in complaints and designed a process, but really our consumers are the ones that would make the complaints and would actually be experiencing that whole process and that service. And so for us, it's really important that we have our consumers involved, and so what we're planning is a workshop with consumers and our staff to actually look at what's working in our process, you know, what's not working, and actually design a complaint process that meets our consumer needs, requests. It's easy for them to navigate. Hopefully they'll never have to use it, but, you know, ideally it meets their needs, as well as ensuring that we're meeting the requirements for standards and things like that.
Thank you. All right, another question, and this one's on remuneration, and how do you guys work with remunerating your consumers, what your policies and things around that are?
So I'm happy to start. We pay a sitting fee to anyone who's on a committee. I must say that not everyone seeks that reimbursement, if you like, and we pay travelling costs, that sort of thing, but we don't remunerate per se.
Right, and Sheila and Lauren? No,
at this stage, no, we don't remunerate either, but I think in the mental health space, there is a requirement to provide some remuneration, but at the minute we don't currently. But as Sue said, you know, people really want to give back, so we're probably lucky in that space.
Thank you.
And Sarah, I just wanted to add, there's other ways of thinking about remuneration, not just money. And so it's things like providing people with training opportunities or those types of things. And again, that might be something you might co-design with your consumer group and ask, what's the best way to show appreciation for your time? These are within the constraints, of course, of our organisations where that might not always be possible. But we have worked with some of our consumer groups who've kind of said, you know, having access to training, being able to present at conferences and those types of things have been really valuable experiences, which they have really valued through the process. Over to you again, Sarah, sorry.
Thank you, Dash. Okay, so a question from Hayley, and this one is to Sue. You mentioned that one of the community advisory groups, consumer advisory groups, meet on an ad hoc or ad needs basis. And the question is, how do you keep them engaged until you need them again?
That is a really great question. So we really had trouble with that CAG with participation, and it got to the stage where meetings were held just because we had them scheduled in the diary. So because it came from them, and they are very engaged, and there's another group who are thinking about doing the same thing, and so because there are other ways for them to be involved with it. I must say that Helen and Michelle, the program managers, work very hard at communicating with consumer reps and volunteers. So there are emails that go out every week, and for some people who aren't, who don't have IT support at home, we do the hard mail stuff, we ring, but they come to us when they have a need. And for example, in developing our Reconciliation Action Plan, and also in our preparation for accreditation against the national standard, Standard 2, and how we meet the needs of Aboriginal and Torres Strait Islander people. The Aboriginal elders who work with us were very, very happy to walk around and do an assessment of our environment, and that's, you know, that takes a lot of time. It took them about 3 weeks of almost full-time work to get that done. I don't know if that answers the question. Maybe we're just lucky because they are very engaged, but we work hard at keeping that relationship. And we've worked especially hard during COVID to keep them informed. We've sent any communication out to staff, and sometimes that was twice a day in the rapid changing environment, say June or July last year. Michelle and Helen were sending stuff out to volunteers, sometimes synthesised so that it was able to be digested by them, and we're always there for responses.
Thank you, Sue. There's lots of questions in chat coming through, so just let you know if we don't get to your question, we'll try and follow up afterwards, and we'll have an email out, and including any links and things that you'd like to have. So we've got another question from Julie, again about remuneration and about when you do pay people, are there ways to do it to avoid affecting Centrelink and other sort of payment issues that might come up?
I can't imagine how it would ever affect Centrelink because it's such a little amount of money. But there are rules and guidelines, and it's based on the ATO reimbursement formula. So I don't think there would be a problem with Centrelink. But if I'm very happy for you to distribute my email, and I'll put you onto Michelle, who knows a lot more of that detail.
Thank you, Sue. And we also have our Monash Partners remuneration guidelines, which I can share the link for that as well. And a part of the work that we do with the consumers that we work with is we provide vouchers, and for different vouchers that people choose. It might be a Coles Myer voucher, Woolworths, something like that. Okay, so lots of links. I'm just working through the questions.
Sarah, we have someone with their hand up, and I'm just wondering whether or not, Jen Chung, did you have a question you wanted to ask? I'm just going to put you to allow to talk to see if you have a question. Jen, are you there? Not sure. Maybe not. Okay, keep going.
I actually think we've gotten through. So there's a bit of comment and questions there around the gift cards, and a few people look like they've been using that approach as well. So I think, are there any last questions that people have that you'd like to ask Sheila or Sue or Lauren before we finish up?
Sarah, it's Sue. Can I just talk a little bit more about co-design?
Yes, please do.
I'm really happy for that question because I have the very same question, because there's co-design, which is we sit around and we talk about what would be a good idea, but there's also the research methodology, you know, the methodological approach, and we do both. So and it really depends on what the consumers, it depends on what the project is. So for our comprehensive care project, that's a PhD student, it's a student's project. So obviously it's got ethics, and we're using that methodological approach. We have a grant application with Monash Uni, and we're lucky enough to have an expert on co-design wanting to co-partner with us. So we're really hopeful that, well, we've got everything crossed that will be approved. So in answer to that question, it really depends on what the project is and how widespread it is, but all of the variations of what we use.
I love that you shared that, Sue, because I think it's a really important distinction as to sometimes what is happening in the research realm. We have to meet certain requirements and robustness and methodological things in that area, but that's not always going to be appropriate for health services where things might need to be done very rapidly. And as you said, it's project specific, but it is something that Sarah and I have been thinking about as to whether or not we offer a bit more training around co-design and the different models and approaches that there might be out there. So again, if that's something you're interested in, please put that in your evaluation survey, and we can also tap a few different speakers on the shoulder who have had experience in co-design, and maybe we'll get someone who's doing co-design specifically in health services as well, just to be able to show a bit of that contrast. So that's super helpful. Okay, Sarah, did you have the next lot of questions? Because I know we're running short of time and we want a survey completed.
Yep, so we've got, so the survey will pop up automatically, Dash, so we don't need to do that, but we've got a comment and a question. So let's go with the question and we'll finish with the comment. So we have a question here about what are some of the question here is, what are the top 3 attributes that make a great consumer? So maybe Sheila, do you want to have a go at that one?
Wow, that's a very good question. I think, oh wow, I think flexibility, a real understanding of what the role is, and I guess just an open mind, because you know it's evolving. So I think yeah, good question. I don't think there are any specific attributes, I think, but flexibility. So you've got a lot more experience in this space. As I said, we've still got our training wheels on, so you might like to answer that.
Sure, and thanks for the question. It's a really good question. Before I go to the answer, and I know we haven't got much time, I haven't spoken about what it's like to work with a consumer representative or a volunteer who may have challenging behaviours, which is why the recruitment process is so rigid, and which is why we have policies and procedures in place, including performance management, where that needs to be addressed. So, you know, it's not all the bed of roses. 99.9% of the time it is, but there are times when you really need to have those processes so that you can defer to them. And Michelle and Helen are very good at their jobs in that regard too. So the 3 things that we would be looking for is someone who shows up, who says, I want to be involved, someone who's honest, and someone who asks lots of questions. Mind you, we have to, as as Sheila and Lauren spoke about at the Epworth, we need to build that capability in, and so training is really important. You need to have a really good training program.
Thank you, Sue. And so there was a comment that came in with that one, says anyone can be an excellent consumer representative or advisor if they're supported well, briefed, and go through that selection process. And our last comment, I think we'll finish with, and I think that came from Terry, but I've lost the name there now, is just with the gift cards, just to be mindful that some health services have different policies and things around what gift cards can be provided. But the suggestion was Officeworks and other retail shops are quite good ones. So I think that is most of our questions there. Thank you very much, everyone, for all those wonderful questions and comments. It really helps give a lot of depth to our conversation and provide lots of ideas and food for thought for everyone to take away. Okay, so Dash, are you ready to?
Yes. So thanks again, Sheila, Sue and Lauren. That was fantastic. We learned a lot from all of you, seeing some excellent comments, excellent presentation. Thank you, brilliant session. So thank you for your time. Just to plug some of our future seminars coming up, we've got Dr. Rhonda Garrard speaking on navigating power imbalances in consumer and community involvement, which I think is going to be quite an intriguing one to come along to. In June, we're going to have the Monash Partners team and a panel of consumers who will give their experiences on what works, what doesn't work in being involved in consumer and community involvement. And in July, Professor Helena Teed will be coming and she's going to be talking about incorporating consumer and community involvement into your grant applications. So put these in your diaries. You can register via Eventbrite again, and be in contact with us. If you have any questions, visit our website, and thank you very much for joining us. Excellent.